Think of your penis as a sponge. And actually, that's what it is. It's a tube with sponge tissue. Now, as we get older, the sponge becomes used and broken. I often use the analogy of a new sponge. I can take that little sponge and I can put it in water, and it's going to suck up a lot of water very quickly. And when I wring out the sponge, it's going to push out all that water, and it's going back to its original shape. An older, damaged sponge does not do that. It's difficult to get a lot of water into it, and even more difficult to get all that water out, and it doesn't keep its shape. There are a lot of medical conditions: hypertension, diabetes, a lot of medication. Again, your hypertensive medication, your anxiolytics, your antidepressants, alcohol, smoking, all of these damage the sponge tissue and the blood vessels that go there. So we use platelet rich plasma, or PRP, to bring about rejuvenation and restoration of not only the blood vessels that lead to the penis, but this actual sponge tissue. The platelets are responsible for releasing growth factors, as well as clotting of blood when there's an injury to a tissue. And in releasing these growth factors, it's like giving cells the blueprint of how to repair themselves. We also call in new tissue, new cells, new blood vessel formation. And this leads to increased blood flow to the penis. And we all know that more blood in the penis is going to give you, one, a bigger erection, a firmer erection, and you're going to be able to keep it for a longer time. Why? Because oxygen-rich blood needs to flow in, and oxygen-poor blood needs to flow out. And this is where the sponge comes in. If I have a new healthy sponge, blood can go in, can suck up a lot of water, and I can push it back out. Bigger, harder, stronger, for longer.